app is downloaded, type in and search for DZRJ. And now you can choose and enjoy DZRJ 810 AM and RJFM 100.3 anytime and anywhere. Hey, it's free.
You are watching the multi-awarded Radio Bandido TV on channel 224 Sky Cable and TV Plus boxes. Simulcast on DZRJ 810 AM. Informing, advising, and entertaining the Filipinos and OFWs around the world. Streaming live on www.facebook.com/DZRJ 810 AM or on YouTube, channel DZRJ 810 AM, Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with Makati Med as we discuss the latest health and medical topics with doctors from Makati Med. For a healthier and uplifting lifestyle, tune into Healthline with Makati Med on DZRJ 810 AM, Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with Makati Med, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from Makati Med interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with Makati Med. I'm your host, Nicole Jacinto. We are here with an episode especially for men, actually. And with us, we have Dr. Steven Nazareth of Makati Medical Center. He is a urology specialist or a urologist. And welcome back to the show, Dr. Nazareth.
Hi, how are you? Good to be back.
Yes, I'm okay. You've been a guest for over the last since we started Healthline, but your visits with us are too far and between. I'd like to hear more from you, though. Thank you for coming on today. And today we're gonna discuss a basic urological health. Okay, so Dr. Nazareth, maybe you can just do a brief overview of what urological health is, or as we go through it, I'm sure people will understand. But as I already said, it's a show mostly for men, and of course, men who care for them. So, what are the most common urological illnesses that you find, like for men who walk in your clinic, or any statistic wise, whether it's in the country or out of the country? Can you give us an overview on that? Thank you.
Okay, so just a brief view on what a urologist is. Basically, we are the counterpart of gynecologists.
Okay.
Some minimum, but of course, we are not limited to the men, in particular, especially if you have stones, which is the most common. That's what you were asking. Hindi naman sa male lang yung stones. We also have stones on females, and of course, yung mga recurrent urinary tract infections, we also treat that. But of course, when it comes to men, it's usually the prostate, and of course, yung mga kidney diseases like cancers and all those, and of course, the ever famous erectile function or dysfunction, however you would want to put it. And those are basically our line.
Yes, and we'll talk about more about erectile dysfunction a little later. I'm sure many people would like to hear more about that. At what age should men start maybe doing checkups with a urologist? Do you see many men
Mhm.
coming in like on their own, or is it usually when a problem happens already, or they're uncertain, or what age should somebody start checking?
Okay. Usually, it's standard that when you reach the age of 50, regardless of whether you feel something or not, you have to. You have to consult us. Yeah, we have to see you and find out if there is already a starting problem or already is a problem that you just refuse to recognize.
Yes, yes, that often
Mhm.
happens, including with me.
Mhm.
I mean, we should be more mindful of our health, and we should take the time.
Mhm.
Okay, so age of 50, you should come in whether there's a problem or not. You refuse to recognize, or maybe you're just uncertain, no?
Uh-huh.
Right? I
Exactly.
mean, it might be something, and we can talk about some of the signs and symptoms later. And maybe you just think it's par for the course, but you could do something to help them. A urologist like yourself could do something to help a patient.
Well, kasi sometimes, unfortunately, others would just accept it as is, thinking that it is how they should feel when
Mhm.
they age, which
Yes.
is you don't have to suffer through that.
Mhm.
You know. Mm-mm.
Yes, thank you. Thank you, doctor. You're just talking about age earlier and how both of us are young. We're young at heart.
Yeah, at
Okay.
heart, yeah.
Okay, so doctor, you mentioned cancer earlier, and can I ask you what the signs, or what, not the signs, but the symptoms are, and risk factors for prostate cancer? You also mentioned the prostate as
Yes.
only the males have it. So can you tell us more about that?
All right. Prostate cancers, this is the most common cancer in men.
Mm-hmm.
When it comes to the urinary system. Unfortunately, you do not feel anything. That
Mm-hmm.
is why it's very important for you to have a checkup, a regular checkup, even if you don't feel anything. Because most of the cancers, especially in the prostate, it's just coincidental that you found out you do have one. More often, you came in for something else,
Mm-hmm.
whether a heart problem, whatever problem it is, and
Mm-hmm.
then all of a sudden, they work you up, the doctor works you up, and then you find out, oh, there is a problem with the prostate. Then that's the only time you find out.
Yeah.
Oh, kasi if you have like symptoms in the prostate, mostly from age-related, difficulty in urination.
Mm-hmm.
As you age, the prostate becomes bigger. This has nothing to do with cancer.
Okay. All
You
right.
cannot do anything about that. When you age, you have enlargement of the prostate. And when the prostate enlarges, oftentimes you will have difficulty of urination. Unlike cancer, it has nothing to do with that. But you only think you have difficulty in urination, and then all of a sudden you have like cancer of the
Yeah.
prostate.
That's why it's
Mm-mm.
important to come in for those checkups, no?
Yeah.
Yeah.
That's why we said at the age of 50, because usually that is where the chance of you having cancer is gets higher. And
Mhm.
of course, if you have like a family history, like if your dad has prostate cancer, it increases your chance of having one
So that's
because
a
it's
risk factor.
genetic.
Yes. Okay.
Yeah,
So risk factors are genetic. Is there any
yes.
environmental risk factor also, or would you like?
Okay. you you when you like your meat,
Mm-hmm.
like your four-legged animals,
Mm-hmm.
and then your fatty food, yeah, that increases further your developing prostate cancer.
Mm-hmm.
But of course, these are just add-ons. It doesn't mean that if you stay away from these, or if you do not eat this, you're not going to have it.
Mm-hmm.
It just increases a little bit further
Mm-hmm.
your chances of getting one if you are a meat eater, but
Okay.
doesn't necessarily mean that you will be spared.
Okay. So you're
Mhm.
four-legged animals. So if you eat like rats, I'm just kidding. Okay. So
Yeah.
it's probably healthier or leaner. I don't know. I'm just joking around, folks.
Mhm.
Making a
Mm-mm.
little bit of light here with Dr. Nazareth, who has a great sense of humor. By the way. And
Yung iba ha, sabi ko, yung, what do you call this, yung pork, the one leg lang, like yung, what do you call this, yung knuckles. Oh, that's
yeah,
also considered a four-legged animal. Na baka
yes,
sabi, isa na lang to eh. No, no, it came
no.
from a four-legged animal.
Yes, that's right. A lot of people will joke around also and make excuses like that. So yeah, so
Mhm.
basically, it increases your chances, but it doesn't mean that, it doesn't, it could be that it doesn't increase it significantly. You're just
Yeah.
putting a warning there. It's just like telling people, like, if you eat meat all the time, and then also the way it's cooked, your cholesterol could go up. So just
Yeah.
be mindful of that. Okay. Thank you, doctor. All right. Now, when you were saying that sometimes prostate cancer or an enlarged prostate is just an incidental finding, because like you can
Yes.
check out for something else. And you did mention that the prostate, and it gets larger over time,
Yes.
age.
Yes.
So that's a normal process, it getting larger.
Mhm.
So you shouldn't panic if they say your prostate is a bit enlarged. But when it comes to uh, you know screening for prostate cancer, how does that happen? How do you do that?
Okay. There are usually three basic things that need to be done. Okay. The first thing is the ultrasound. Okay. The kidneys, the bladder, the prostate, and then of course your blood test, your PSA,
Mm-hmm.
and of course the ever famous or notorious digital rectal examination.
Yes.
So
Can you
that
tell
would
us more
mean,
about that? Is that how you
uh,
do a proper prostate exam in
yeah,
screen? Because, yeah, because if
it
it's
should be part of.
yes, if you say it's an incidental finding, you can't just decide. I mean, you can't just totally base it on that. Like, oh, woe is me, I have it, or you panic, no, or I don't
Uh-huh.
know, I'm just gonna let it go. Okay, so can you
Uh-uh.
tell us about that, doctor?
Okay, so in digital rectal examination, this is not high-tech kasi sabi ka, oh, digital.
Uh-uh.
No, digital in medical terms means your finger. A
Mm.
digit is a finger.
Yeah,
Okay,
the
so
digit, yes.
what we do is insert this finger
Mm-hmm.
up your rectum to
Mm-hmm.
feel for the prostate. Kasi the prostate is very near your anus.
Okay,
So when we do rectal examination, we can easily feel for your prostate.
okay.
So there, we can see if it's your prostate is soft or hard or firm or bumpy. It should be smooth,
Mm-hmm.
or is it tender to touch? When you touch it, you kind of feel pain. All
Mm-hmm.
those we can find out through a rectal examination.
Okay, doctor. And doctor, I think this is what many people are, there's a stigma still around.
Uh-huh.
There's still a stigma around it. Um Many people are, well, they don't want to talk about it. It's okay. It's your health, it's your privacy, but
Uh-huh.
there's also like a stigma around it, and kind of like jokes about it. I mean, do you find that yeah, I mean, come
Yes.
on, you're going to go get a test, and then you
Mhm.
have to like not discuss it, or
Mhm.
there's some kind of shame for some reason. um
Mhm.
and then the only ones who talk about it a lot are either those who are, well, not a lot, but they talk about it openly, are those who are very, just, I guess, more enlightened, or not,
Mhm.
prone to peer pressure, or
Uh-huh. Yeah.
that kind of thing. And some are just, well, let's not mention the others talk about it a lot, but and
you, you know what I think helps?
mhm,
If you are a social person.
yes,
Because if you are a social person, that means your peers are within your age and also
yes,
so they kind of compare notes. Oh,
mhm,
this is what I feel. This is what my
yeah,
doctor tells me. This is what I take. So
yes,
if others become more open,
yeah,
I've had quite a lot of my patients, na it's not really the partner, the wife or whoever that tells them to
mhm,
consult somebody, but it's actually the barkada
yes,
because they are of the same group. They would compare notes. Oh, yeah, this is how I feel. This is what I am gonna. Also, you should visit your urologist.
yeah,
A lot of them, they would tell me, I said, Doc, we have this, yung weekly meeting or we go out
mhm,
and then we would compare notes.
mhm,
We would compare medications that we were taking.
yes,
They would tell us that's why a lot of them would see me because they were not really forced into it.
yes,
But it gives them like parang openness. with the
Mm-hmm.
disease. Oh, pwede pala, I need to consult pala somebody for this. And I can actually ask help from somebody.
Yes, and that's very
Uh,
good. And I think the same is true with, well, at least the women that I know. And I know quite
mhm,
like it is sort of a, well, I think maybe you should go. Okay. It
mhm,
doesn't
yeah.
always have to come from a medical professional or their partners if their partners are men, but just friends or relatives and
Mhm,
discussing some things and oh, okay,
yeah.
I'll go and check it out. Yeah, even
Mhm.
problems from like why am I peeing so often? Things like that. And
Yeah.
oh, it's because you're drinking like 8 liters of water a day, which is it could be a good discovery
Yeah. Yes,
or
yes.
an unpleasant one, but you medical professionals are there to help. And for men, especially, doctors and urologists like yourself are
Mhm,
there for them. So thank you for giving that tip, doctor, because maybe there's someone watching and, if they're hesitant, maybe they can ask their barkada. Like, hey,
yeah,
have you
exactly,
experienced
exactly.
this, right? Then, or
Uh-huh.
their brother or something, even their fathers
Mhm,
or sons, and maybe, maybe they will go and check it out. And if everything's
mhm.
okay, everything's okay. Okay. Thank you, doctor. Now, um, we're gonna talk about actually when we get back. We just have to take a short break, doctor. But when we get back, folks, we're gonna talk about erectile dysfunction. So stay
Oh, yeah.
tuned with Makati Med. We'll be right back.
Hello mga kaaha! Kami sina Elisa at Yvette, ilan sa mga batang bidas ng Aha Balitang Bata. Ito ay isang teleradyo show na ginawa ng mga bata na para sa mga bata.
Dito, nabibigyan kami ng espasyo upang pag-usapan ang aming mga katanungan sa sarili, sa pamilya, sa kapwa at sa lipunan. Nakikipag-partner din kami sa public schools at rescue centers.
Kaya ano pang hinihintay nyo?
Subaybayan ang Aha Balitang Bata dito sa TCRJ 810 AM, Radyo Bandido TV. Huwag kalimutan, tayo ang pagbabagong ating hinihintay. Kita-kits mga kaaha!
Watch and listen to Aha Balitang Bata every Saturday from 9 a.m. to 10 a.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
Hello everyone, for those who are always tuning in and listening to DCRJ 810 AM Radio Bandido TV, here I am again, once again inviting you to watch and to listen also to Power to Unite with Elvira every Saturday from 5 to 6:30 p.m.
Watch and listen to Power to Unite every Saturday from 5 p.m. to 6:30 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
Hi, I'm Nicole Jacinto. Join us on Healthline with Makati Med as we discuss the latest health and medical topics with doctors from Makati Med. For a healthier and uplifting lifestyle, tune into Healthline with Makati Med on DZRJ 810 AM, Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with Makati Med, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. Stephen Nazareth. We're discussing urological health. And this show is, of course, mostly for men and also the women who want more knowledge and who maybe not care for the men, in terms of everyday living. But, if you've got a father out there or if you just want to learn more, the show is always here for you. It's a platform for learning, for information and education. Okay, so doctor, I did say we'd be back to talk about erectile dysfunction. Now, what causes it? Okay, basically erectile dysfunction, let's just break it down into common terms.
Uh-huh.
You cannot, when you're when you want to have sex, so the desire is there.
Uh-huh.
You have to tell me a little bit more, because I mean, I don't know what it's like to actually have erectile dysfunction, because I'm not
Oo.
male, right?
Oo.
So the
Yeah.
desire is there to have sex, but the
Yeah.
penis does not harden enough to have sex.
Oo.
It okay.
Well,
Okay.
if we want to be medical
Sige,
about it,
okay, go
the
ahead.
true description is it's the inability to
Mm.
obtain and or maintain an erection
Okay.
enough for penetration and ejaculation.
Okay.
So there are several, I don't know, depends on the degree.
Mm-hmm.
One is either you cannot get one,
Mm-hmm.
or two, you do get one, but it's enough for an actual penetration.
Okay.
You do not just penetrate, you have to actually finish the
Okay.
act. So those other types, true definition of erectile dysfunction.
Okay. All right. So, doctor, what often causes it, and is it very common in the population?
Okay, there the most common is age.
Okay.
Regardless of whether you're the healthiest person there is, the mere fact that you are aging, say you do develop some plaques on your um, arteries.
Okay.
Kasi erection is, if you have erection, that's like blood that gets trapped in your penis,
Okay.
causing an erection.
There should be blood
Now,
flow. It will.
yes.
Okay.
So if you have like plaques on your blood on your the arteries on your penis, the blood will find it very difficult to penetrate to go
Mhm.
through. Okay, so nothing will come out. This is like a tap water that
Mhm.
your pipe is kind of small already.
Mhm.
Nothing gets through, so that no matter how much you open, nothing will come out. Okay, so that is also what happens when you have trying to get an erection, where
Mhm.
your artery is kind of blocked. So
Mhm.
no blood will ever pass through, and you will have problems with erection.
And doctor, this plaque is like the typical like cholesterol. Is that it?
Yeah,
Yeah, okay. All right.
yes,
Okay.
yeah. That's why if you're diabetic,
Mm-hmm.
there's a higher possibility if you will get these because the diabetes it affects the small and medium sized artery.
Okay.
And so as we I don't know, it's the artery in the penis is a small sized artery, so
Oh,
it easily get affected. And another cause is the smoking.
oh, smoking. Yes.
Yeah.
Yeah.
Okay. So if you're male and you're a smoker and you're diabetic, wish I
It's
could say that you're gonna
hard.
be fine.
Yeah.
Yeah.
But
Mm.
that's more factors adding up to
Yeah.
probably,
Exactly.
yes. And then, doctor, is it only older men who get erectile dysfunction? Aren't there younger men who get it also?
Yeah. That's a good one. Of course, most of the patients are the older individuals
Mm-hmm.
because if you some younger ones can have this, but of course you have to ask: is there really a problem, or is this something psychological? Because they're young.
Yes.
Supposedly they have no, I don't know, they have no illnesses, no diseases. But if you are taking some antipsychotic drugs,
Okay.
drugs that to calm you down,
Mm-hmm.
sometimes you are so calm that you cannot get it up. So
Okay.
that's why when you're younger, you have to ask all these things. Are you like taking any medications?
Mm-hmm.
Okay, but because most of them are taking these medications, and then I would tell them that this is going to be the problem. Maybe you can ask your doctor if we can limit your medication so that you can have sexual function.
Okay. And doctor, there are, I mean, as you said, actually if you look at the side effects of many medicines that help people with their other, like let's say their anxiety or their other
Uh-huh.
health issues, it does say there that it can lower your sexual desire even for women.
Yes.
So
Yes, yes.
so that's something. But yeah, so you ask them to, maybe you can talk to your doctor, is there something else you can
Mhm.
take, or find the right combination, because so that's how you approach your patients basically, because uh it's, I mean, maybe they can't get off the medicine or not,
Uh-huh.
right?
Exactly.
But yes, okay, so it understanding is required all around.
Mhm.
And doctor, when what are some of the what what are the treatment options aside from that?
Okay.
Okay, for erectile dysfunction.
Oo. Of course, the quick fix always is some tablets that
Mhm.
are readily available. No,
Mhm.
your sildenafils, that can help with the erection. No, depends on how many you should take, when you should take it.
Mhm.
Depends on what goes on with the conversation with your doctor.
Mhm.
Then, of course, you need to find out also, is this just something that you're undergoing because of age, or
Yeah.
is there like a mental issue that goes with it?
Yes.
Like you're too tense and you too with work, too much going on with work.
Mhm.
So all these things, I say, you need to ask the patient.
Mhm.
Then you would tell them that maybe you should go on a vacation
Mhm.
or try not to stress over it, because sometimes you also have to talk to the partner,
Yes.
because sometimes the partner doesn't understand the common thing that the partner would say is they would even instead of being supportive, they would have this, maybe you don't love me anymore.
Yes. Or they don't get it because, well, I also, I've seen some relationships, no, and
Mhm,
sometimes I mean, what I notice is just as an observer is that there's so many things that people have to take care of, both partners, and then
mhm.
one reaches out physically and the other one cannot, and then it becomes
Uh-huh.
of contention. And
Yes.
sometimes it's the opposite. It's the female who doesn't want. I mean, if they're in a
Mhm,
heterosexual relationship between male and female, and it's because of so much tension. And
mhm.
there's a lot of
Yeah.
misunderstanding because there's a feeling of rejection, or that's the only way they can connect, you know.
Mhm.
And,
Yeah.
and
Mhm.
then there's often things that, like, oh, because you don't do this enough. Like, it starts becoming
Yes.
a battle of, oh, you don't do this enough. You don't, because somebody feels attacked,
Mm-mm.
or
Mm-mm.
both feel attacked. Yeah.
Oo. Kasi, well, we have to understand that, di ba, sabi nga, yung sexual relation is the highest form
Mm-hmm.
of, you're showing your love for somebody. And then once this is broken,
Mm-hmm.
parang there are a lot of doubts.
Yeah.
Now that is where the emotional problem
Yeah.
starts. Sometimes that's why sometimes you have to treat both the partners.
Mm-hmm.
Na well, there is really something going on with the
Mm-hmm.
patient. This is nothing. This is not just an emotional problem or a mental problem. The problem does exist, and there is a medical problem that led to this one.
It, it
So it
really
just
is
takes,
physical, but there is an
yeah,
emotional and psychological
yes,
component. Do you sometimes
yes,
refer patients to, like, psychiatrists or counselors or anything like that if they're not?
yeah. Because sometimes yung partners may be kind of hard
Mm-hmm.
to convince. Even if with your best effort,
Yeah.
you tell them, nah, this is really something that's going on,
Yeah.
and if they cannot, come into terms on what
Yeah.
the problem is, then I wouldn't. It would be nice for you to talk to a like couple, doctor who is specializes in treating couples,
Yeah.
like uh, psychologists, psychiatrists, whoever's.
Mhm. Yes, doctor. Um, just in my experience as a person, I've found some, like, where, when they would be like arguing or discussing, actually, yeah, these issues in front of me, it just seems like, it also doesn't help when, the men in the relationship have this thing of, like, oh yeah, pare, sexy, blah blah. Especially the older generation, they have that much thing going on, and then the wife is like, yeah, well, I don't see you proving it. Because these things also,
Yeah.
the behavior, like, yeah, okay, parang the way they talk, or I've even seen people have, like, flirt with a stranger
Mhm.
in front of the wife.
Uh-huh.
Oh my God. Like, when that happens and it doesn't, why are you doing that? You can't even deliver. So, of course, she'll be like, is it me? Is it,
Uh-huh.
and then all of these
Exactly.
things will come up. So, yes, best to discuss it and have an open mind, and also, like, understand. And then sometimes I also, well, let's not go into because I'm not a counselor or a psychiatrist, right?
Uh-huh.
But I mean, I'm just mentioning things like as a non-medical professional, that,
Uh-huh.
maybe it's like a moment where someone will be like, oh, therefore I shouldn't be like, doing that in front of other
Yeah.
people or friends. And
Mm-mm.
that might be something there. So, okay, thank you, doctor, for answering all those questions. So, but you did say the first line is it's always easy to take a pill. Are there any
Yeah.
other treatments for erectile dysfunction?
Yeah. Before, we would have like something that you would put inside your penis, your urethra, and we also have like the injectable that you
Mhm.
would directly inject into your penis.
Okay.
Okay. But unfortunately, it's becoming harder and harder to find one in the Philippines because ever since the tablet came up, we have lost yung mga injectables
Yeah.
or the one to put in your urethra.
Mm-hmm.
It becomes less appealing to patients kasi.
Mm-hmm.
And then of course, yeah, you have to find out what other medications are they taking. And you do not decide. I do not personally
Yeah,
decide na,
the
no, you have
patient.
to stop this.
Yeah.
Oh, yeah, I tell them maybe you can ask your doctor if you can change your
Mm-hmm.
medication or maybe lessen it to help with with the erection. And
Mm-hmm.
of course, like lifestyle.
Mm-hmm.
If you're like a meaty person, you're a
Mm-hmm.
meat eating person, your cholesterol level has to go down. Your sugar has to go down. So it's
Yeah.
really a holistic
Oh,
approach.
that's the approach.
Because these things put together
Mm-hmm.
can really help a lot.
Okay.
But take yung one and remove one, it might not really do much.
Yeah, so you do have to
Mhm.
maybe a little bit of everything, and some
Uh-huh.
understanding is there, and
Mhm.
and um and all of that. And doctor, okay, the question of male infertility comes up. Uh,
Mhm.
all
All
right.
right.
What are the because I guess maybe when you're younger and or you think you're of fathering age or something,
Uh,
Okay, so how how can you say that a male is infertile, or what causes it? Let's say it's not erectile dysfunction. You
yeah.
know, they have a healthy sexual life, and what can cause it though?
All right. Okay. So again, to define, what
Yes.
is infertility? Ito naman is inability to conceive a child
Mm-hmm.
after 1 year of trying
Mm-hmm.
without protection,
Okay.
okay, or without contraception.
Mm-hmm.
So, yeah, unfortunately, like more than half of the time, it's
Mm-hmm.
unknown what the cause is.
Okay.
And then in a couple, it's
Mm-hmm.
usually 25% the men
Mm-hmm.
have problems. In 25%, it's the women who have problems.
Okay.
And 50%, both men and women have problems.
All right. So what were the
So,
percentages again for usually?
yeah, 25 for male alone,
Mm-hmm.
25 for female alone,
Mm-hmm.
and then 50 for both male and
Oh, you
female.
really split it down the middle, so it's nobody's
Yes.
quote
Di
unquote.
ba? Yeah, di ba? So, it's ano din na talaga. Kasi before, di ba? Like,
It always been the women.
ages ago, it's always the
Yes.
women, di ba?
Yeah.
But they found out that no, not really. It's really 50-50 for both men and women.
And they would also blame the women for why don't, especially when you watch those historical dramas, the queen won't give me a son. Well, actually, it's the
Mhm.
sperm that gives the extra
Yeah.
supply, right?
Mhm.
So, okay. So,
So
yeah.
yung mga usual, if you have like a varicose veins on your testicles,
Mhm.
when you have varicose veins, this causes an increase in the temperature of your testicle, and if the temperature is too high, the
Mm-hmm.
sperm becomes sluggish. They
Mm.
don't produce as good a number of sperm, or sometimes they just produce lesser and lesser of the sperm.
Okay. All right.
Mhm.
I see. Okay. So there's semen, but no sperm. And not enough sperm in
Yeah,
it. That
not enough. Yes, not
not
enough.
enough. And sluggish.
Because yeah, Because they think na every ejaculate is all sperm. No, only 10% of that is sperm. 90% of that are just juice.
Yeah.
So it's just fluid.
Yeah.
So that 10% is the one that's really very important.
Okay. All right. So,
Yeah.
and then, do you, what are, how can men like sort of, okay, that's one reason. Are there men
Uh-huh.
who really, okay, it's determined your infertile period, or could there be some changes? I mean, could there be an improvement? And
Mm-hmm.
how can men take better care of their health in that sense? Like, let's say they're trying to conceive
Mm-hmm.
children. I mean,
Okay.
yes, they're trying. Yeah, go ahead.
Yeah. Sa male part,
Mhm.
number one is better make sure that your testicles are not really in a very hot place,
Yes.
literally. So that's why you need to cool down.
Mm-hmm.
So that would mean no steam baths,
Mm-hmm.
no hot showers, no
Okay.
wearing of hot clothes, especially underwear. When
Mm-hmm.
you're no briefs,
Mm-hmm.
more of boxers,
Boxers
and
not.
then yeah, you cannot go on hot places. Halimbawa, you're staying outside, under the sun. That
Mm.
should be avoided as much as possible.
All right.
So it's usually the regulation of the heat.
Okay, regulation of heat because that heat makes your sperm sluggish. Okay.
Yeah, and lesser in number.
Okay. Walk around with an ice pack. No, maybe not.
Exactly.
You
Oh,
can? Okay. Sige.
yeah. Oh,
All right. Okay. So that's one way you can do that. And then doctor, when it comes to testicular, okay, sorry, they're telling me that I should speed up my questions if there are any other questions. Sorry. Okay, we're talking about male infertility. That's important.
mhm.
Um okay. And thank you for telling the men out there how they can maybe, sort of ensure more and maybe working with a doctor like you, no? I'm sure it gets more complicated than simply that.
Ah, yeah. Infertility, it's not an easy task. Huh? It's kind of difficult to treat. It's not like ABC, one,
Yeah.
two, three, medication, you're done.
Yeah.
No, it's kind of frustrating sometimes.
Yeah.
Even if you've tried so hard
Yeah.
to fix everything, nothing ever works. So
Okay.
that's why, that this is the time I realized talaga na every child born is a miracle
Mhm.
because you should see the couples wanting so much to have a child and couldn't. It's really frustrating for everybody.
Yes.
So, uh, just love what you have because it's kind of rare.
Yes. Thank you.
Yeah.
That's a very, very beautiful thing to say.
Mm-mm.
And also you can spread love around by adoption and all of that. There are some
Oh yeah.
who can't really care for their children, no matter how they may have gotten here. They may not be directly your blood, but
Mm-hmm.
you can make a difference, and they can make a difference in your life as well.
Yes, exactly.
All right. So, doc. Oh, by the way, once if it's been determined that you're infertile, that's it, or could there be a point in your life when suddenly, zhing, a guy gets to conceive?
Oh, unfortunately, there are instances that there's no way you can father a child.
Mhm.
Okay, especially those who actually had mumps when they were
Yes.
younger.
Hi, the mumps. Okay, tell us
Oh
about.
yeah, because sometimes it cross reacts, meaning you have mumps, and then all of a sudden your testicles are swollen. So
Mm.
what happens is your own body fights the sperm. So that's why you don't produce sperm anymore.
So your immune
That
system
is
kills your own sperm, basically something
yes,
like that. Okay.
because yung sperm, just to give you an idea why,
Mhm.
our body, if but this is very medical,
Yes.
very technical, yung diploid, they come in pairs,
Okay.
everything. But our sperm, it is what we call a haploid. It only contains one because you get the other pair of genes sa babae.
Okay.
Okay, that's why you have your father trait and your mother trait.
Mm-hmm.
But as a person, all of your ano is yung diploid two pairs. So somehow the body detects your sperm to be different because it's only haploid.
Hey, this is not right. Why is it only half?
Yeah, exactly. So that's why they produce antibody to kill your sperms. If that happens, sorry, nothing you can do about it. You're not gonna produce sperm anymore.
Okay. All right. So that's, and then why the mumps? Because it gets swollen, is that it? And then once it
Yes.
swells up.
Tapos, they have somehow they recognize the testicle
Yes.
also as a part of their what they should attack.
Yes, when somebody has
So
mumps. Yes. When a
when
guy
somebody has
or a woman
mumps,
has mumps. Okay.
they have similarities, but we don't really know exactly what those are. But somehow, this doesn't happen to all people who develop mumps, huh? But for some who develop mumps and they develop testicle inflammation, infection of the testicle, that's gonna be difficult.
Okay. Okay. So, doctor, let's talk about testicular cancer.
Uh-huh.
It's one of our, um, what exactly happens there? What causes it? And what, when you get testicular cancer, like, what happens? At what
Mhm.
does it usually happen? And what are the symptoms?
All right.
Go for it.
Now the testicular cancer, unfortunately, this is not known as to who develops one. You just develop it. There are two age groups where this is commonly seen. Number one is 20s to 30s,
Mm-hmm.
and number two, 50s to 60s. So
Okay.
this is, if you do develop testicular cancer, this is the one that's fairly more common in younger people.
Yeah, I mean,
Yeah,
just from watching the news, like, oh, okay, or the
yeah.
movies.
So
Yeah.
what happens is you suddenly develop enlargement of the testicle, which is not painful.
Okay.
Because you can have enlargement of of the testicle, which is painful, and that usually is associated with infection of the testicle. But if the enlargement does not cause pain, you should see, well, both you should see, but all the more if there's not painless enlargement, because that is usually associated with cancer of the testicle.
Okay. And
Mhm.
what could cause that, doctor? And does it happen like it's usually just one testicle first or both at the same time? Like what?
Uh, we don't really know what causes it. Now, more often, there's just one testicle that gets involved, although it's not unusual for both testicles to be involved also, but you have to think of other causes
Mhm.
because there's a lot of type of testicular cancers, and one in particular may cause
Mhm.
left and right involvement.
All right. So that would be like
Mm-mm.
delving into it more with Dr. Nazareth on
Uh-huh.
another
Uh-huh.
another show because yeah,
Uh-huh.
it's different kinds that can cause it, and there's one in particular, one cancer in testicular cancer that can cause both left and right, and then
Mhm.
usually though it manifests as like one testicle at a time, I guess. Okay.
Yeah.
So
Yes.
doctor, when it comes to, let's say, prostate cancer, testicular cancer,
Oh, wait, I forgot.
yes.
One common cause pala ng
uh,
testicular cancer is if you have a cryptorchidism. That means your testicle did not go down to your scrotum. It
yeah.
stayed, yeah, it stayed in the abdomen because when we're young,
Mhm.
it's usually it's in the abdomen, and before birth it goes down. Usually seventh to
Mhm.
eighth month of life of ano pala of conception,
Mhm.
it goes down.
Mhm.
Sometimes there's failure of the testicle to go down. That will make you more prone to develop testicular cancer.
Okay. Yeah, the same goes for dogs actually, because when you
Oh,
compare dogs to I don't know why I'm just saying that. Oh, okay, there's so many similarities between, I mean, like, because you'll hear a campaign for, have your dog neutered, and then they will say, because the balls didn't go,
uh-huh.
the
Yeah,
testes
I did
didn't
not know that.
yeah, but sorry. I mean, I'm sure there's vets out there going, this girl must have dogs. Yes, I do. And then, but yes, we also learned that in health class, but very briefly, like it goes down. It's not automatically there at a certain time.
Uh-huh.
Down, and when it doesn't descend, and you don't find out right away. No, sometimes you don't find out until later on.
Yes, yes,
Oh,
yes.
all right. So it's a good thing I remember terms like scrotum, testes, urethra.
Mhm.
You know. Okay. So when it comes to let's say treating testicular cancer and prostate cancer, sometimes let's just go to the because we I want to make most use of the time. When it comes to the point of like you really have to have it removed, your
Mhm.
prostate or your testicle. Now, when one testicle is removed, does that render you that doesn't render you unable to have uh that doesn't make you give you erectile dysfunction, right?
No, it does
No.
not.
Okay. If both are removed, it does.
No,
No. It's
it
your
doesn't. It just makes you infertile because you aren't
infertility.
able to, yeah, unable to
Because
conceive.
there is where the sperm and semen.
Sperms are produced.
Okay. Now,
Mhm.
for your prostate, if a
Mhm.
prostate has to be removed, does that make you erectile?
You develop erectile dysfunction.
Yes,
It can,
it
but
can.
there are surgeries already that can decrease the possibility. This is what we call nerve sparing surgery, no? The problem is if you already have erectile dysfunction before the operation, then it's not going to get any better when you have it removed.
Of course. Okay. So just
Mhm.
wanted to clear that up, bring it to that conclusion for the two, so that no question. Well, I'm sure a lot of people have more questions, but you should really check out Dr. Nazareth. He's a great doctor.
Yeah.
I haven't been to you personally for myself, but I do remember
Hmm.
I always mentioned this, recommending someone to you, and you helped him a lot.
Oh,
So
yeah. Oh,
yeah,
yeah.
you helped him last. You don't even remember because you're just a great guy helping out whoever you can.
I think he has a stove, right?
Yeah, the kidney stone, but
Uh-huh.
he didn't get it. You know, I don't know what. Then he
Mhm.
didn't want to continue or something. But you were really good and supportive. And I said, well,
Yeah.
can't do
Uh-huh.
anything about it. It's up to you. Like you were helping him out, so
Mhm.
there. And then you're like, people are probably like, why does Nicole know all this? It's the way I am. Just someone to the hospital, send them there, and
Mhm.
so anyway, if we can help people through the show
Yeah,
and through the doctors in Makati Med, then that's a dang good thing. I mean,
exactly.
that is a dang good thing. Okay, doctor, when it comes to, so people will say, how about incontinence?
Uh-huh.
Incontinence in males. Does it happen when they're older, when they're younger? What's
All
that?
right.
You were
But
saying
of course,
males have a hard time urinating if their prostate is
mm-mm.
larger, but what about all?
Now, yung incontinence kasi, no, there are several causes.
Mhm.
Now, the most common in men
Mhm.
is actually a prostate problem.
Mhm.
So what happens is there's like an overflow incontinence.
Okay.
That means you're not really emptying your bladder well, so it
Mhm.
just flows out.
Yeah.
It's it's just like I would always tell them, it's just like a glass of water you put under the sink, okay,
Mhm.
and then just let the water run.
Mhm.
So the excess water will just spill on the glass, but the glass is still full.
That's a really, really great analogy. And it
Yeah.
happens to women too. Like if you're rushing and then, parang
Mm-hmm.
kind of stop your pee. You didn't actually
Yeah.
empty your bladder. And then you're like,
Mm-hmm.
I feel like peeing again. Ganun. It's
Yeah.
because
Exactly.
it happens,
Exactly.
and especially with this rushed lifestyle, no? And
Mm-hmm. Yes.
so yes, okay. So that's one of the things. Okay. So basically
Mm-hmm.
there, and then there's an overflow. Are there reasons, medical reasons why the men might feel or males might feel like they've emptied it, but it's not empty yet?
Yeah. It's mostly because of the prostate.
Okay.
If the prostate is too big, it presses on your urethra. That's
Mm-hmm.
why the flow is impinged. So
Mm-hmm.
you do retain.
Mm-hmm.
Um, some in your bladder,
Mhm.
so it gets filled
So
faster.
then it makes sense that you would have to pee more often.
Yeah.
Yeah.
Yes.
I mean, kind of very, just like that glass that you mentioned. If you only
Uh-huh.
pee half of it out, then it's going to get filled faster again and then it will
Faster.
overflow. That's a
Uh-huh.
great analogy, doctor. Okay. Now, doctor, is there anything, I mean, you mentioned smoking before with the kind of and are there other things because um that you could give advice to males or to men, what kind of advice can you give them in terms of what they eat, their lifestyle, or drink or do, their
Mhm.
lifestyle factors in helping prevent all of these problems, or
Mhm.
just keeping their urological health,
Yeah.
as best as they, as just keeping neurologically healthy as best as they can. I'm making up
Mhm.
phrases here. Urologically healthy, okay.
Yeah. Okay. When it comes, patients would ask me, how can I prevent my prostate from enlarging?
Mm-hmm.
Well, I told them it's the easiest thing to do.
Mm-hmm.
Just stop aging. Yes.
Oh,
If you stop aging, your prostate will stop growing. No, because it's as natural as your age,
yes.
okay? As natural as growing white hair or
Mhm.
losing hair. It's
Yeah.
age related. So you can't do anything about that. The most that you can do is really consult a doctor.
Yes.
Um, and then, of course, the prostate cancer, aside from not eating certain stuff, there
Mhm.
are also other stuff that you can eat that will decrease the possibility of prostate cancer. It's not guaranteed, but it will definitely help. Like if you eat like lycopene-rich food, tomato-based products.
Ah, tomato. Okay. Yes.
Yeah, but you have to remember that fresh tomato is not as good as cooked or processed tomato
Mm-hmm.
because you need heat
To
for
bring.
the yes, for the active ingredient of the tomato to come out.
Sorry, I'm just getting into cooking now. I mean,
Mm-mm.
not cooking for. I'm just getting into discovering this. I'm trying to learn, because for health reasons, actually not even
Mhm.
for myself, but I should, like, yeah, there is a chemical change that happens with food. Like sometimes we're like, duh,
Yeah.
I'm like, duh, Nicole, I forgot that that's the reason why.
Yeah.
So some things are
Mhm.
better raw, better for you.
Yeah.
Some things are better for you cook. So that's a great
Yes.
reminder. So tomato, but you should
Mhm.
cook it,
Yes.
or maybe make a
Yes, you should.
pasta, or
Uh-huh. Uh-huh.
tomato sauce is already, that has a lot of
Yes.
salt though. But okay, I'll let you talk. Sorry, I'm not a
Mhm.
dietitian either.
Yeah, but that's a problem there.
Yeah.
When you process a food, of course, you have to put salt for it to be preserved.
Yeah.
That's the trade-off. Yeah, and broccoli does help.
Now,
Yeah,
what is this thing with asparagus? I think that's just like a joke that it makes your pee smell different or something. I love asparagus,
yeah.
by the way, but I
Uh,
hardly eat it.
it's supposed to smell more.
But that has
It's
nothing to do with health of the.
no, 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 no. It just you're just more stinky.
Okay. All right. Okay, so things with lycopene, like, that can help prevent the enlargement of the prostate.
No, cancer of the
Sorry,
prostate.
cancer of the prostate. Okay,
Yeah.
all right.
Not aging will prevent enlargement of the prostate.
Not aging. Okay, so should we look around for? I wonder if the vampire myth is true that you stay the same or you heal faster. Here we go. That's discussion is for another show and on another program where Doctor and I will talk about
Exactly.
vampires, immortality, and all of these things.
The fountain of youth.
Yes, yes, the fountain of youth. And what good is
Mm,
it if you don't have the people you love with you in the same state?
exactly.
So,
Mm.
and that's for another discussion on another show with Dr. Nazareth again.
Mm-mm.
Okay, Doctor, is there anything else you'd like to say before we say bye for this week to the audience?
Yeah, I would just like to remind everybody that please don't be afraid to see us, urologists. Our clinic is always open for you. The things that you think might be associated with age alone, you don't need to accept that.
Mm-hmm.
There must be a better way
Yes.
to age gracefully.
Thank you,
So-
doctor. That's what I've been trying to tell some people. Did you get it? Oh, kasi they're watching now. Okay.
All right. Yeah.
And then thank you, doctor, for being on the show. Please come back again soon. You always
Oh
make
yeah, of course.
And we can talk more about urethras. It's one of my favorite medical words, urethra, urethra. Anyway, thank you, doctor. I have certain favorites like amygdala, urethra. I just have this. I don't know why when I was getting
Uh-huh.
attached onto them. Okay, but thank you, doctor. I like the words. So thank you for being on the show. Thank you, folks, for watching. We'll see you again next week on Healthline with Makati Med. Bye-bye.
Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.